Hi, I'm Dr. Akiba Green. I want to talk to you today about gluten. We do a lot of work with food sensitivities, a lot of work with helping patients with gluten sensitivities, celiac disease, and the intricacies of immune reactions of gluten. We're talking today about a subject that has to do with what the immune system is doing inside your body when gluten comes in contact. We're actually going to talk specifically about a cell called natural killer cells. And you've all heard of antibodies, or many of you have. That's where your body makes something to tell you to attack a piece of the body. We're going to talk about those too, but we're going to forget those for today. And what we're going to do is we're actually going to talk about natural killer cells. Now, I deal with food sensitivities and autoimmune disease in close to 90% of my patients. I felt I would talk about a key issue that often gets forgotten if we don't talk about it. There are multiple grades or types of inflammatory bowel disease. The really easy one for me to treat is celiac disease. Gluten avoidance is what's required to fix it. So it's an autoimmune disease, but if you give up gluten, you are fixed. There are also a lot of host problems which are responsive to gluten avoidance, which do not come up positive on traditional antibody tests or have a typical celiac gut biopsy showing positive. I found this article, and it grabbed me because of the link to the immune system soldiers. The natural killer cells, their relevance to surviving disease before antibodies kick in. So the introduction to the article that I'm talking about was very key, and I'm not going to bother you with the actual terms themselves. It gets really detailed into the science. But what it's basically talking about is gluten stresses your gut cells. They scream on the molecular level. Natural killer cells get in and put them out of their misery. This is what's called autoimmunity. And it does not require antibody production. And that's key because you can have an autoimmune attack without showing antibodies. Antibody production appears to be an add-on to the immune system. It's a memory storage facility for preventing future reinfection with the previously encountered bug, something that we would call an active antigen. Now, it's not always a bug. It can be an invader. The body thinks all invaders are infections. That includes foods, it includes metals, viruses, chemicals, stressors. This acute survival of an infection, like influenza, relies on this innate immune system, which is based around these natural killer cells, which are immune system soldiers. Now, if you had to wait 10 days for your white blood cells to get around to antibody production before you recovered, all viruses would be lethal to the human body. Natural killer cells are non-specific. They use certain molecules as markers that something is seriously wrong with the cell, and it's time to get a kill on. So that's what's your body's going to say, all right, go take care of them, get rid of them, and sends the soldiers out to do their job. The molecule that we're talking about here is called MIC. It's like a very large target sign painted on a cell, and the natural killer cells are equipped with AK-47s looking for that particular target. Usually a cell expresses this MIC when it's infected, but gluten appears to do as much stressing as an actual viral infection. Like I said, it doesn't have to be just a bug, it could be a food sensitivity like gluten. Gluten reactions do not need antibody production. It's perfectly possible to have serious ongoing gut damage without a positive antibody test. Statistically, it's quite probable that you will get a positive antibody test, but I have a number of patients that come to me complaining that the testing we ran showed they did not have a problem, so why can't they eat that food? I have to explain to them either the correlation between their autoimmune disease and that food, or the other tests that pointed towards that food being an issue, or most importantly, how much better they felt once they got rid of that food. And really the key thing is this explains why. And there's so much damage going on in this battlefield of the immune system. And, we're talking about your gut, where so much of that occurs. And when the influence of gluten gets there, there's this big traumatic soup that occurs. And all you need is for something called an antigen presenting cell, or an APC, to collect some gluten from the soup, give it to your white blood cells, and tell them, we want this stuff recognized by an antibody, go produce it. Well, of course, the antigen presenting cell may pick up tissues, proteins, or hosts of other problems to push at the white blood cells to make antibodies, but there's a chance you may not get either enough gluten or enough protein or enough transaminase or these other tools presented, so no antibodies show up on the labs. You continue with what we call psychosomatic gut problems, or you get labeled as inflammatory bowel disease, which is not regarded as gluten responsive. So severe IBD requires more than gluten avoidance, but this basic step is probably essential. Giving up gluten is most likely an essential part in treating it. Antibodies are a consequence and an amplifier of gluten toxicity, not a cause. This is important. This is intrinsic to gluten, MIC, and natural killer cells. Now, what brought this on? I'm going to speculate a little bit. Did I have psoriasis or dermatitis herpetiformis, which is celiac disease of the skin? Maybe it's the same parallel as gut problems. These ingredients can specifically get into the systemic circulation, these antigens. So it's a reasonable assumption that gluten get in there too. So when we talk about the psoriasis versus celiac disease of the skin or dermatitis, it can be landed on either vascular or dermal cells in the skin. Gluten lands and it induces stress there in the expression of these MIC cells. Now what happens is, remember your soldiers, your natural killer cells, have AK-47s, and they have a really itchy trigger finger, and they're looking for these big target signs, these MICs. So sometimes there's antibody production, sometimes there isn't. And that could be the result of genetic receptors on your antigens, it could be the result of inflammation, having enough of an exposure. You know, different labels, different lab results, if it ever gets that far. But a similar approach to treating it is always needed. You know, perhaps there are a host of immune problems that are triggered by gluten that are not antibody producing. I want you to continue scheduling with me, Dr. Akiba Green. Consider scheduling with me, Dr. Green, to see if your gut health could be caused by gluten or other food sensitivities. And we can really help figure out if this is an issue that you're dealing with, or if you are okay eating that food. You know, a lot of people wonder, do I have to make the changes? Again, you know, if you want more information or to schedule an appointment with me, visit my website. It's www.drakibagreen.com. It's right in front of you. You can also call 704-987-3993 and ask to schedule with myself, Dr. Green. Thank you very much.